Normally, IVF is done in patients with normal sperm counts. However, in patients with severely low count of sperms or severely abnormal sperms or very poor motility sperm, IVF tends to fail. So, if you have an egg and you try to do IVF in a severe male factor infertility, the egg will not fertilize. So, in these patients where there is a male factor infertility in the form of poor count or poor motility or highly abnormal sperm, in these patients instead of doing IVF, ICSI is done. So, the procedure is nearly same as IVF. You give injections for 11 days, take the eggs out, but the fertilization technique is different. In IVF, we take one egg and put 1 lakh sperm on the egg, and one of the sperm itself fertilizes the egg. But in ICSI, what we do is we take the eggs, we dissect the eggs, and we hold each egg with a machine called a micro manipulator, and we pick up one sperm with the micro manipulator in an injection pipette, and we inject the egg directly into the substance of the egg. And so the fertilization technique is different between IVF and ICSI. It is a forceful injection of sperm into the egg to achieve pregnancy, and that really has been a major breakthrough in male factor infertility. Nowadays, if there is a male factor infertility, we don't do IVF, because many times in severe male factor infertility, if we do IVF, there will be failure of fertilization of the eggs. We go directly for ICSI. ICSI has got other applications also in patients where there is zero count. There is no sperm in the semen. What we can do is we can go directly into the testis with a needle, aspirate the testis tissue, look for the sperm and pick up the sperm and inject it into the eggs. So even patients with azoospermia have started becoming pregnant. So much so that if there is a very severe azoospermia called non-obstructive azoospermia where the testis has failed, nowadays what we can do is by opening the testis using an operating microscope, we can actually identify areas in the testis where the activity is going on of sperm and pick up those small tubules by the aid of operating microscope. This is called micro TESE, and then these tubules are sent to the laboratory and we search for sperm. And would you believe it, a lot of people, nearly 50% of people who have failed testes can get sperms by the technique of micro TESE, and these sperms can be used for injecting into the egg and achieving pregnancy with ICSI. It's a real major breakthrough in male factor infertility, and our unit is highly specialized and we do this technique a lot, and we have had a lot of pregnancies in non-obstructive azoospermia.